Well, eye on the pandemic. Florida has more than 17 million doses of the vaccine, but only 4.8 million people have been vaccinated so far. Some say at that rate, it could take years to inoculate the population effectively. And as the pandemic drags on, it's taking a toll on hospitals and medical professionals. Not only are they worried about their own health, but those long hours is leading to burnout. CBS 12's Jay O'Brien speaks with nurses and doctors tonight about that impact. Jay?
Yeah, Jim, this isn't just a problem in South Florida. It's happening across the country. Signs of severe stress, even post-traumatic stress in people on the front lines of battling this pandemic, making their jobs a lot harder.
When Brittany Reedy sat in a hospital parking lot on New Year's Eve, flipping through these memories, she saw a year memorialized in scrubs, marks on her face from masks, and the countless deaths she's been forced to watch.
Over 50, for sure.
That's a lot for someone to take.
Over. It's over that.
The ICU nurse working in Palm Beach and Broward counties has seen more patients die in 2020 than at any other point in her 8 years in medicine.
There's no words that can really describe what it feels like. It just feels like a living nightmare. Like this is still happening.
Reedy's watching now as fellow critical care nurses start to show the signs of anxiety and post-traumatic stress.
A lot of nurses are leaving. A lot of people are leaving bedside.
Statistically, nurses are some of the most likely to feel COVID burnout. According to a study from Mental Health America, 8 in 10 healthcare workers reported feeling emotionally exhausted, and more than half felt work-related dread as a result of COVID.
Try to practice due diligence.
ER Dr. Tiffany McCullough recounts another problem: concerns about infecting relatives.
When I'm at work, this is what I think about. I think about my babies. I think about how I don't want them sick.
Reedy has moved away from her family to avoid exposure. She finds the only people who truly get what's going on in the ICU are other nurses and doctors.
If you go out, everything seems perfectly normal. You would think that nothing's happening. And then I go to work and it's just like it's two different worlds.
We reached out to 4 major healthcare companies that own dozens of hospitals in South Florida and asked them about if they've seen higher staff turnover, particularly amongst nurses as a result of burnout. Only one has gotten back to us so far, Tenet Healthcare, and they said they're not seeing that. I'm Jay O'Brien, CBS 12 News.